Hello, thank you for joining me today. My name is Michelle O'Connor, and I am the owner of O'Connor Insurance Associates. We are located in Charlotte, North Carolina. And the presentation I'm going to do today is, are your agency employees ready to return to the office? So I wanted to introduce myself and then share with you why I decided to do this webinar, and then I'll give you the format for today. So a little introduction about myself. I own my agency with my husband, Terry. We started it 20 years ago. So January of 2000 was our 20th anniversary. Prior to that, I worked for Erie Insurance Group as a district sales manager, and I was transferred to North Carolina specifically to recruit in the western part of the state. Erie was expanding their footprint into that area at that time. And so I was fortunate to be recruiting for Erie and training new agents with Erie. Most of them had lots of agency experience, but just getting them familiar with Erie and then helping them with their staff as well. And I absolutely loved recruiting. I really love working with agents. I think we are a very special and unique breed, and I am very proud to be an independent agent. Insurance agents take care of people in their worst moments and are there to hold their hand and attempt to make them whole when they face the unexpected. And I'm proud to belong to such a unique group of people that gives back to the community in so many ways and employs so many people in our communities and in our small businesses, of course. I am lucky enough also to serve on the Independent Agent of North Carolina board. I serve District 4 as a board member, and I love working in that capacity and serving my fellow agents in that capacity. So why a webinar? Well, as the May 8th stay-at-home order date got closer and closer in North Carolina, it dawned on me that I didn't have a plan for getting my staff back to the office. So I started doing bundles of research, trying to figure out what I needed to do to make sure everyone would be safe and healthy. Did I need to bring everybody back? Are we going to have visitors? There were just so many questions that kept coming up. What will team meetings look like? How will we have conferences with one another still? So I thought all of the research that I had put together, I would like to share with my fellow agents. So that's why I decided to do the webinar today. I hope you will enjoy it. I certainly hope that you get something from it. And most importantly, I hope it opens a discussion amongst all of us to be able to share ideas moving forward, because this is such unprecedented times that I believe we need each other more than ever right now to know what to do and to be creative and how to handle some unique things that come up in our agencies. So the format for today will be, I've got a PowerPoint presentation I'll turn on in a moment. That'll take about 20 or 25 minutes depending on how fast I talk. And after that, I've got time for questions and answers. So everyone's muted right now, but I will mute you at the end because I would love for us to have a great open discussion and share information and collaborate with one another. In the meantime, though, if you have a question or a comment or you want to point out something, if you would put that in the chat box so you don't forget, then we can go back and I'll read those out so everybody can hear and we can go through those as well. So without further ado, I am going to share my screen with you and go back to our video presentation. Excellent. So we got through our introduction. So let's talk about our step-by-step guide to returning to the workplace. So these are the 4 major questions that I tried to answer in developing my plan of action for our agency. First of all, the time frame. The North Carolina stay-at-home order ends on May 8th, and it has been officially announced just last night that we are in fact moving into phase 1, which is awesome. I am so excited about that. Next, does our staff even need to return to the office at this point? Will all of your office staff return at the same date? And will there be a day, or will you implement some sort of a swing schedule? And then after you've determined all those things, now what? What do we need to do to keep our team members safe, to keep our office cleaned, and to make sure any guests that we do need to have are safe and taken care of? So before I do this, I am going to ask you to complete a quick poll. How many of your staff members are working from home right now? I know that there are lots of different circumstances which required some of us to keep staff in our agencies, but for the most part, I think I'm interested to see who has that and who has a combination of things. So, okay, ready? 3, 2, 1. I'll go ahead and end the poll and share with you all. So it looks like the majority of, well, it's actually split right down the middle. Half are working from home and the other half have a combination. And then there's some that are still at the office right now. So thank you for sharing that information. That helps tremendously. So as I mentioned, the North Carolina stay-at-home order has ended, will be ending at 5 p.m. on May 8th. South Carolina ends on May 12th, in case we have any South Carolina friends joining us today. North Carolina then goes into phase 1. So what does that mean? Well, phase 1, there was a couple of interesting things that jumped out at me. One, as we have heard in the news, our malls are going to reopen. So there will be shopping allowed. We're allowed to leave our homes to go out for commercial activity. The retailers and servicers will need to provide and implement social distancing, cleaning, and other protocols. So services includes our agencies, of course. We have to limit gatherings still to no more than 10. The face coverings are recommended in public, and the teleworking is still encouraged. So for those of us that have folks at home, this is where that question begins. Do we in fact need our business, our employees and our staff members to go back to the office? So there's a bunch of questions that we have to answer before we will be able to get a good feel on this. First of all, the answer is different for every agency. It depends on lots of things that you have going on within your office. Are you comfortable with your team's remote capabilities? I know most of us probably very quickly moved and transitioned our team to a remote environment. I know I did. I assessed it on Friday, and I spoke with my team members on Sunday, and by that evening had made the decision. So I didn't allow anyone to return back to work on March 13th. Everyone went to their home offices at that point. We're pretty lucky that we have a lot of technology in place, so that was an easy decision for me to make. My team members it was very easy to get them into the positions that they needed to be in their home offices with almost no effort. So that worked out well for us. Not everybody's got that same situation, and so it might have been a little bit more cumbersome, and you might not be comfortable with the capabilities in which your team's working right now. Also, very important question, do you serve clients who do not have access to electronic means or who have to make payments in your office? We all serve different clientele, and this is, of course, a very important question. We're in the Charlotte metropolitan area. Our agency has been electronic for many years. We haven't accepted payments in our office for more than 15 years. We're by appointment only already. So transitioning this way was nothing, it was doing business as usual, with the exception that we did have to, in fact, remind our clients that there is no one at the office, but we have video capabilities, we have electronic signature capabilities, so we were all set. But if you service a clientele that needs to come into your office and you haven't been open or you've been working on limited staffing, this would have a big impact on my decision whether or not to reopen. Next, does your staff like working at home and are they efficient? So for us, this was a mixed bag. Ironically enough, my 2 youngest team members are the ones who were not working at home as well. One of them had told me verbally that she did not care for working at home. She lives alone, so she didn't have any hiccups at home. She just really likes the structure of going to her work office, and she believes that she gets more done in that environment. Another one of my team members is living with her parents and had a ton of technology issues related to the internet. Our phones run off of voice over IP, so she was having some issues with that, and it was really creating a lot of frustration for her. And so it made sense for her to go back to the office. So this week we moved to a combination where we have a couple of our team members in the office and the rest of them are all remote. The last question, and this is one that it might not be quite time to answer, But when is it time to attempt the new normal? When do we decide that it needs to be business as usual? It might not be during phase 1 in North Carolina of this stay-at-home order, but perhaps as phase 3 approaches, which should be somewhere in the 4 to 6 week time range if everything goes well in our state. When's it time to say it's time to get back to business and have our offices open in the same capacity as normal? Or does our new normal involve allowing our employees to decide whether they're remote or not? I've done a lot of research on remote workers and what that means and how that feels. And I don't believe there's a one-size-fits-all answer to that. You have to say what works best for your staff and how you feel about your team members being remote. So then let's move into the next question to consider. Your actual physical space in your office, to me, has a big deciding factor in how you're able to get everyone back to work in a safe environment. So if you're able to pull from your archives your original drawings from whenever you rented or you purchased your space, I think they can provide a lot of assistance in mentally mapping out the space and talking about how you can safely get everyone back into the office space. So this is ours. We purchased our units, I think 16 years ago now, but I did still have my original drawings. So I'm going to walk you through them. It's kind of tiny, but I'm going to kind of walk you through. For those of you that have been into my office, this is the area that goes into my office. Right here is our reception area. I did have a team member sitting there. She was the one that was greeting guests, of course. And so this area right here is very open. We have our common spaces, and then we're fortunate to have walls with doors in all of our other offices, but we do share 2 bathrooms as well. So one of the things we did was we moved this reception person to this open office space right here. So that provided her with not only 6 feet from everyone else, but also a door. That way she wasn't exposed as everyone walked in and out of the office as well. So I felt like that was a good move. So now that just leaves our common spaces that we have to deal with in the restrooms. If you have an open floor concept, so if you can envision for a minute, there are no walls in here. Lots of offices had moved to that very popular concept of having the space be very open. You may have desks, you may have cubicles, but if there are not physical barriers and or the ability to move the desks 6 feet apart, this could pose a problem for how you're going to get your staff back into your office. So if it's an open space, the 2 main considerations would be, are you able to physically move the desks at least 6 feet apart or more, whatever you're comfortable with? And if not, are you able to provide some sort of a barrier? That may mean investing in cubicles. You can even rent the cubicle spaces on a temporary basis, just maybe 6 months to get through and see whether or not you feel like you need them. You could also get creative and use plywood, cardboard, or I know a lot of the retail stores have gone to having plexiglass in between. One other thing to consider is whether or not you were allowing any desk sharing at this point. That would also be a factor in being able to decide when to bring your team members back. So once you've looked at the physical space and you've assessed it and determined whether you can bring everyone back or not, now we have to talk about the next questions. So I think some of that depends on how many team members you have. We have a total of 6 spread out amongst those offices, so I was quite comfortable with the setup that we came to. If I had 15, I believe my answer would have been different on how I'm going to move everyone back. I think it's very important at this point to consider how you're going to handle your employees with children at home. With all the schools being closed through June and many of the summer camp activities getting canceled, this is going to look a lot different than it has in previous years. That's likely going to mean, as agency owners, we're going to have to exercise some flexibility with our staffing in an already stressful situation to ensure that they're not have an additional burden of not having childcare and being required to return to the office. There's a lot of things that we need to balance in that question. There's also a bigger question. How do we handle employees' requests who don't have children at home, but they'd like to work from home, and treating them fairly so that we're not unfairly penalizing them for not having children that they're homeschooling. At this point, it's a good idea to start talking about whether or not your return to work will be a gradual shift or everyone returns to the office on a specific date. There's a lot of creative solutions out there. Some folks are doing, staff members have, Monday, Wednesday, Friday, 1 week, and Tuesday, Thursday the next week so that they can alternate team members. You can do a week on, a week off. You can do every other day. There's a ton of creative things that you can do. Or if your space allows it and you're comfortable with it, you can make the decision that as of May 15th or June 1st, that everyone will be back in the office on a back to normal basis. So next thing is, how are we going to make sure that our office environments are clean and safe for both our team members and any clients that you need to have visiting? The first thing to consider is just plain how much traffic you'll have in and out of your agency. If you are going to be open to the public, which we'll talk about in a moment, that will have a lot more traffic coming in and out. As I mentioned, we have almost no traffic in and out of our office. However, right before this presentation, one of my team members messaged me to let me know that one of our vendors, the shred company, had showed up to clean our shred bin. Since they were unannounced, my team members went ahead and let them in, but that's going to require me to rethink vendors as well and how that's going to go. So we'll talk about that in a minute. As far as cleaning options, if you don't have a commercial cleaner that you currently have working with you and working at your office, this might be the time to engage them. I've spoken with our commercial cleaner and he offered me two different choices. We can have them do what he calls a hospital grade cleaning, which involves using disinfectant products that are known to kill the virus. Or we can have him do what he's calling a complete sanitation and disinfecting. I know a lot of major companies and large organizations have embarked in this complete sanitation and disinfecting. My commercial cleaner described it to me as they spray the solutions on, they wait a specific time frame to make sure that the solutions have time to activate and kill germs, and then they go back and wipe them down. It's quite involved and it takes a more lengthy amount of time. So you'll have to pick which one works best for your office, but hiring a commercial cleaner and determining a regular schedule for them to be in your agency is going to be very important at this time. There's also a lot of cleaning practices that we're going to need to implement in our daily office lives. I'm positive you have somebody that probably does some cleanup for you normally, but what about the common appliances that we have? Are you going to allow staff to use them, or are we going to remove them temporarily from the offices? For us, that involves a small Keurig, a microwave, and a little refrigerator. With restaurants being closed and me not wanting my staff to feel like they have to leave, I've made the decision that I'm going to allow the appliances to remain in our office, but I am going to ask that whoever uses them wipes them down with a disinfectant wipe immediately after they're done using the item. The other question that comes up is that removing or limiting of shared equipment that I mentioned earlier. If you have folks that did share a desk, this would be the time to make sure that you have desks specifically for each individual team member. If you have a postage machine or scanning machine that you are having shared in the space, now might be the time to figure out either a different protocol or to purchase scanners for each desktop, which is what I'm considering right now. We front end scan, so there's very little paper that floats around behind the scenes, but the paper that does float around is being scanned on a shared machine. So we're going to need to make arrangements for that. And then what about the surfaces that everyone touches every day? The doors, the locks, the light switches. Having a staff member that disinfects those at least once a day or more if you've got lots of traffic coming in and out needs to be built into your daily protocol. Next, we're gonna need to have some new processes and procedures in the actual office space for our team members. This is gonna be super important. So hand washing, mandatory. When you walk into the office space, hands need washed between meals. And I'm also advising if they've touched their faces, my team members, that they need to, those sneezes from all this fabulous pollen we got floating around, need to go wash our hands. Maintaining 6 feet of social distance is going to be mandatory in our office as well. This is pretty hard for our small office. We enjoy one another. Typically when we're training, we're standing over one another, or we go into a small conference room that has a large screen for us to be able to share information, but there's no way to be 6 feet apart in some of those spaces. It disappoints me to say that, but that's the way that we're going to have to remain. The item that we've added is to add masks in our common space. If you recall, I mentioned that we have bathrooms in common and we have some shared hallways, of course, and I'm going to ask our team members to keep masks on in those spaces, at least for the month of May, and I'll reevaluate it at the end of that month, just in order to protect everyone else. All of our team members have other family members that they come in contact with on a daily basis, and so I feel like this is just the safest thing for everyone. We instituted this 6-stay home policy after the first of the year. Our office got hit really hard with the flu. We had lots of members that were sick in and out of our agency from December through February, really. We had just all regained health when this crisis took hold. So I had been very diligent in asking our team members that if they were not feeling well, to please stay home. If you have a larger agency, more team members, you may be considering temperature checks. I know a lot of folks that are in tighter spaces are in fact doing that. There's definitely some protocol that you'll need to figure out with those temperature checks, namely who's going to do them, if they've been properly trained on how to use the thermometer that you've purchased for them, and if they understand the false error readings that can come up from that. And then also having a process in place for if somebody does in fact register that they have a fever. So I think that one's one that needs a little bit more digging in if that's something you're considering in your agency. Above all else, I put owner flexibility on this list because I know that we have protocols in place for calling in sick, for if you've been out for so many days, for a number of things written into our handbook. At this time, a lot of those things are going to have some flexibility. So if someone believes that they have a fever or they don't feel well and they decide to stay home, but they're still capable of working, perhaps going ahead and letting them do that, versus if someone has tested positive for COVID or maybe has another ailment that they've got going on, and they've been out for a few days. Things like requiring doctor's notes to for so many days out, those things are going to require flexibility, and that most people are not visiting their family physicians right now. And until testing supplies are adequate, they're not necessarily testing to send people back into the workplace. So those are all important things that we're going to need to keep in mind. So for my staff, I went ahead and put together this little handy guide. I'm happy to send this to you separately. I will be sending you the presentation, but I'm also happy to send you this as a separate file so that you can edit it and use it in your own environment. But each of my team members are going to get one of these as reminders. I mentioned washing hands, the social distancing, stay home, wearing the masks, and then wiping down what you touch. My team and I are also contemplating making these available to our clients because, again, I think these are all healthy reminders for everybody, and no matter what space they're in. So there's a couple other processes and procedures that as owners we need to contemplate. One is cross-training, and I have that one on the list because it's inevitable that our team members get sick. Whether it's COVID, whether it's the flu virus, whether it's just the common cold, it's inevitable that they are going to have an ailment at some point. So with that in mind, cross-training is even more important now than it's ever been to make sure that your business can go on if you have 1 or even 2 or 3 people that are out at the same time. Also, this presentation just wouldn't be complete if I didn't mention the FMLA changes that went into effect as of April 1st. They're effective through December 31st. I know that a lot of us got these emails. You may have had a chance to dig in, but while this was going on, it was about March 26th, 27th. I know we had so many crazy things going on at the same time that while I read this stuff, I had to come back and revisit it now that we're talking about putting people back into the office. So again, these links will be provided to you, but some of the summaries of this, if you haven't looked at it, it applies to employers with fewer than 500 employees. So it applies to all of us, regardless of the number of team members that you have. You may qualify for an exemption if it would cause a hardship. My understanding in the state of North Carolina is that you would need to apply at the time. And I've actually got an attorney friend who I'm hoping is going to come on and share some more information with us in a future webinar, who's done a lot of research on that particular item. What it does is it provides employees with paid sick leave or expanded family and medical leave for specific reasons that are related to the COVID-19. I'm going to share a few of those in a moment, but I also wanted to point out that there is a poster that is mandatory for us to post in our locations in a central location. Because we were all working from home, we did circulate it electronically for our team members. So here's the list that I took right off of the government site. But these are the reasons that the employees qualify for paid sick time. I believe the pay is required to be 2/3 of what you normally pay them, and they're able to request it for any of these reasons. So I don't want to go into this in more detail, but just to tell you that it's definitely something that you need to dig into and make sure you understand. But the other part that is super important for you to make sure you read is the tax credit portion. So employers actually qualify for reimbursement through tax credits if you have qualifying wages that you have to pay under this. That was not, it was not publicized in a large degree. So when I first read it, I panicked thinking it could, virtually financially ruin us if we had to pay an employee who we couldn't use their services and we weren't able to replace them, of course. Just opens up a hornet's nest. But I felt much better after I read the tax credit portion in understanding all of this. So I just want to make sure that I've pointed that out to everybody. So now that we've gotten through those items, let's talk about when folks go back into the office and what kind of meetings you're going to allow or not allow. So for our team, we're not allowing any team meetings in person. If they need to have any kind of a one-to-one meeting while they're in the office, again, that's going to include staying 6 feet apart. And for my team in particular, we've been using video conferencing and it has been working fabulous. We have Office 365 and we use Microsoft Teams, and they have increased their video capability and made it so user-friendly that to have a one-on-one is almost even easier because you can pop right into the person's screen or share your screen, and it is seamless. This technology has come such a long way in the last couple of years, and it is very effective in training. We hired a new person on February 24th, and so her world certainly did not get the same training that she normally would have had. But luckily with this technology, her training was almost more effective because we were able to do a lot of these things that maybe in person would have looked a little bit differently. The next question is, are you going to be open to the public? So we've already talked about a couple of the questions that you have to ask yourself about clients and whether or not you have to be open for them. If you are going to be open for clients, are you going to require appointments so that way you don't have too many folks in your lobby at one time? What kind of sanitation practices will you implement for the clients when they come into your office? Are you able to offer social distancing to them? So a couple thoughts came to my mind in this area. One, if you're able to go to the client in their car, that might be the easiest way to handle this. Providing disposable gloves for your employees and masks to protect your clients, and being able to walk out a clipboard or something else that makes it easy for them to sign what they need to would be one way to solve this problem. All those branded pens that we buy every year, this is a great time to give them away, because once a client touches it, they can just keep it in their possession and you can bring a fresh one out to every client. If you have clipboards you'll be using, definitely need to have more than one so that you can sanitize them before you hand them back to another client, and make sure that your employees are using disposable gloves properly. So after they use them with one client, they're going to need to toss them, wash their hands, and put on a fresh set before they go to the next client. Another major question in being open to the public is, are you accepting vendor or carrier visits? So I mentioned today a vendor that came to our door, happened to be our shred company. I did ask my team member what kind of protection they were wearing, and she said only gloves. If you've done any research on gloves, one of the things that comes resoundingly out of the research is, if the gloves are not thrown out and disposed of properly after each visit, they become just as germy as your hands if they're not being washed. So if he's been using that same set of gloves all day, which I've witnessed a number of vendors doing this in the general public, they're not doing any good. They may be protecting the employee, but they're definitely not protecting anyone else. So as a matter of fact, if he's been in 3 other offices with that same set of gloves, he could have inadvertently infected my office because of that. And he came in and touched our stuff. He also wasn't wearing a mask. So a couple things that came to light for me right away was that all of our vendors will be required to have fresh gloves on if they're going to use them. Otherwise, they can just wash their hands when they come in. That's fine too. And they have to wear masks because they need to go into our employees' offices, where the shred bin's kept is in one of the offices. So thinking through some of that stuff is really important. The other thing that's extremely important is who's going to enforce these things. If you've got your receptionist up front and she's the one that's supposed to enforce them, it may or may not work, because her personality is probably very sweet, and she's going to have a hard time insisting that that vendor stop and put a mask on. So I would make sure that whomever you select to be the enforcer of the rules is well-versed, trained, and has adequate supplies, and is capable of doing the job of making sure that folks follow the protocol. The exact same thing is true if you have clients coming out of the office and you're going to have a sanitation process for them when they come in. Who's going to enforce that to ensure that it happens for the protection of the rest of your team? Right now, we're not accepting carrier visits at all. We've done a number of carrier webinars, Zoom meetings, works just fine. For the time being, I think that's off the table, and I hope to have that back on the table by summer, but right now that's off the table for us. So if you've made the decision to return to the workplace, there's a lot of supplies that I mentioned. The bad part right now, these supplies are at a commodity still. So where do we get cans of Lysol that we need? We've got a can, but it's running low and it's not going to last long. And when we get to the end of it, what are we going to use next? Having disinfectant wipes for the common areas. There's also some things that I'm providing at each desk so that folks don't share them. A box of tissues, disinfectant wipes, making sure that my employees have masks, and they need to have more than one mask so that they can make sure that the mask goes through the washer and is dried in a hot dryer before being used again. So we're providing some additional masks to our team members just for convenience so that they don't have to wash their mask every night. And also gloves, like I mentioned, the disposable gloves if they're conducting client appointments. In the restrooms, some additional supplies we need: disposable paper towels to make sure no one's sharing any kind of drying towels, a no-touch trash can, toilet paper. Again, of all the things I ever thought I would have to worry about, making sure that my staff could have plenty of toilet paper and not having to implement a bring your own TP policy was not one of them, but here we are. So making sure that you've stocked up sufficiently on toilet paper, and then also just extra hand soap. I know that all the extra washing, we're going to go through way more hand soap than we normally do. I've got a little back stock right now, and I'm working on purchasing some additional. The other supply that is on my handy dandy checklist over here at the very bottom, but I didn't have on my list, is some computer cleaning equipment to make sure that staff can wipe down their own desks as often as they would like to. Also, I mentioned the thermometer checks. That's not on my checklist, but if you have a large staff or you're feeling like that might be necessary because of all of the people that come into contact with the staff, just make sure that you have thoroughly trained the staff member that's going to be in charge of that. So in conclusion, I cannot thank you all enough for joining me. I'm super excited to kick this conversation off, and I hope it leads to some additional collaboration. Before I unmute everybody and take a look at the chat box, I did want to share with you that next week we're going to host another webinar. I have an HR consultant who's worked with my agency for years, and she is going to assist us with some of the questions that came up in my research regarding employee privacy, and also that FMLA whole section in there. But the privacy issue that comes up is if you know that an employee has in fact tested positive for COVID, how is it that you are allowed to share that information with your staff? What kinds of questions are you allowed to ask the team member if they say that they're sick? How do you inform clients? That might be a question that we save for the attorney, but there's a lot of additional questions that may come up in the next couple of weeks that I would like to have my process and procedure ready to go so that I'm not caught without knowing how to handle a situation that comes up, an odd situation that comes up. At one point in our office, we thought that one of our team members had been exposed to someone, and trying to figure out what that looks like and how we share it with everyone is also a really odd question. So I just wanted to bring that up. I'm excited to have her. Her name is Kim Baker. She owns Baker HR Services, and the invitation for that will be going out before the end of the week, but just wanted to give you a heads up. I'll also be asking for questions ahead of time so that we can make the conversation as productive and useful for everyone as we possibly can. So with that being said, I am going to unmute the participants so that everyone can ask questions and chat. And someone did ask if the PowerPoint will be available later, and the answer is yes. This is also being recorded, and I will be posting it on my website, so I'll be able to share that link with you all as well. So I hope that if you have any other questions, please let me know, jump in. If you have any other collaboration or ideas, love to hear from you. And I hope you're all unmuted. Awesome. Well, seeing none, I am going to thank you all again for joining me. I am very excited to kick this off into a collaboration opportunity. Again, talking with my friends and being able to share has helped me to get through this situation tremendously, helped me to make sense of the things that I needed to make sure that I had taken care of for my staff. And I'm excited to get back to business. I think we need to do it cautiously, but I'm definitely ready to get back to business. So I hope you all have found this useful, and I hope you all have a fabulous day. Thanks so much.